Doctors of Reddit, what's it like when you go in for a doctor's appointment? Do you and your doctor discuss what's wrong with you like it's a group project? Do you not go at all because you're your own doctor? Story 1. Doctor here. It depends a bit on the field of medicine involved. For example, I don't know much about neurological issues, so if I went to see a neurologist, I certainly wouldn't be chipping in. For more general conditions, I have previously offered my thoughts to my doctor about what it could be. Ultimately, I still go to the doctor, as they can prescribe medications and order tests that would be difficult or questionable for me to do on my own. Story 2. I'm a doctor. Family medicine. I usually self-diagnose most things, but when it comes to my 1-year-old daughter, I decided early on that I didn't want to do that for her. Her pediatrician doesn't know I'm a doctor. I never mentioned it. I want her to treat me like any other parent and explain everything as if I'm new to it all. I worry that I might become too casual about my daughter's health, or that the doctor might assume I know more than I actually do, which could lead to missing something important. I've also adopted this approach for myself. When I visit a doctor, for example a gynecologist for a routine checkup, I sometimes don't reveal my profession so that I can comfortably ask basic questions or ensure the doctor doesn't leave out crucial information thinking I already know it. However, my regular doctors, like the gynecologist who cared for me during my pregnancies, do know I'm a doctor. This allows for more in-depth discussions about health decisions, with a focus on debating options and exploring nuances. Things they might not necessarily do with other patients, because they know I understand the medical pros and cons once given a basic explanation. Story 3. Doctor here. Neurologist. I'm not great at going to the doctor. I don't go often, but when I do, I usually just keep quiet, especially if it's a field of medicine I know little about, like dermatology, for example. That being said, the doctor usually knows that I'm also a physician, so the language tends to be more technical. I also find that we practice less defensively with each other since we can be more open. We could do ABC tests, but honestly, you probably have X, so take this, and if it doesn't get better, then we can proceed with ABC. Story 4. I was sitting in on a consultation between two doctors, one of whom needed an ultrasound. They already knew each other from work, so the conversation was friendly and casual. The patient doctor was trying to understand what was happening on the ultrasound screen, while the other doctor was teaching him the parts he didn't know. Story 5. My mom's a GP, and she usually self-diagnoses most of the time, but will sometimes get a second opinion. She doesn't really go to another doctor. She just calls them to ask about things. Her contacts are filled with all kinds of doctors. It's like a secret underground community. For things like getting ultrasounds, they do discuss it as if it's a group project. Story 6. I'm an ER doctor, and sometimes I have other doctors as patients. For the most part, they're good patients because they can describe their symptoms in a useful way. They usually ask good questions and are well equipped to have an informed discussion about their diagnosis and treatment. Sometimes it's hard for me to dial back my patient talk, where I simplify medical terms for laypeople. It can also be challenging when their area of expertise is unrelated to the issue at hand, and they don't recognize their limited understanding. The worst patients are those with just a little medical knowledge who think they know everything. For example, someone might say, "My aunt is a nurse, and she said I need a whole-body MRI for this runny nose." As for self-diagnosing, I usually handle my own minor medical issues, but if I notice signs of something more serious, I would consult another doctor. Story 7. It depends on what I'm going in for. As a background, I'm an oncologist, so I've trained in internal medicine before. For most internal medicine-related issues, I don't bother going in unless I need something that I can't easily get for myself, for example, labs or imaging. For specialty issues that I wasn't trained in, I go in and try to provide the best history I can, but I let them do their own thing. Story 8. I don't get involved in the management. I let the doctors seeing me lead that, unless they miss something significant, in which case I just double-check. The main difference is that I can present the whole history and relevant information in about 30 seconds flat, and the doctor with that information can provide me with the management plan in about the same amount of time. Fastest consultations ever. Very methodical. Story 9. Doctor here. In general, we are not good about going to the doctor. For me, it's physicals about half as often as recommended, and there was that time I had strep a year and a half ago that didn't resolve with whatever antibiotics I had in my medicine cabinet. When we do go in, it's like a group project. We usually hash things out together, but ultimately I will defer to someone with more expertise in that area who can make an objective decision. Story 10. I hope some doctors join in to provide personal answers. Paul Kalanithi touched on this topic in his book, When Breath Becomes Air. During the early stages of his cancer treatment, he was very involved in the decision-making process, and his conversations with his oncologist were more collaborative. Later, she reminded him that he didn't have to be part of the decision-making and could simply let her handle it while he focused on himself. He eventually accepted her offer. So, even between the same patient and doctor, the relationship evolved over time. Story 11. I attended a lecture a couple of years ago, given by two doctors who had both undergone treatment for breast cancer and co-authored a book about their experiences. I remember one of them talking about her diagnosis. She was a breast cancer surgeon herself, something you couldn't make up. She walked into the room, saw her own scans with the doctor, and her heart sank. She barely heard a word he said as she couldn't stop the flood of information she was processing. Just by looking at the scan, she knew whether she would need surgery, chemotherapy, radiotherapy, how long it would take, and her estimated survival rate. I don't think they discussed it like a group project, but I suppose she couldn't help but listen to her own internal monologue, given that it was her field of expertise. I remember her saying that in hindsight it had been an incredible learning opportunity in terms of how to interact with patients, and that she thought about it often. Story 12. Both my parents are doctors, and they treat each other as their own doctors. In their case, they don't need to make appointments for anything. So if I or they catch the flu, they just write a prescription. If they need to see specialists, they usually mention that they're doctors and often receive better treatment, like skipping lines, or they already know each other, so it's more relaxed. I'm sorry if this sounds a bit spoiled, but it's just my experience. Story 13. My mom is a nurse, but she never tells doctors what she does for a living. This is so they'll speak to her not as a nurse, but as a patient. Even though she can understand their medical jargon, she doesn't want them to become overly comfortable using it while treating her. Story 14. Obligatory. Not a doctor, but spouse of one. I thought I might have a ganglion cyst in my wrist because I could feel something inside causing pain whenever I moved it, so I scheduled an appointment with an orthopedic surgeon and a hand specialist. I had my husband come along. He's an interventional radiologist, in case there were questions I wouldn't think to ask or things I'd need more explanation on later. The ortho/hand surgeon was friendly and used layman's terms with me, but switched to technical jargon when talking to my husband. It was amusing to hear the shift between your wrist bones, tendons, and blah blah, anterior blah blah, medial, or whatever he said to my husband. At one point, they performed an ultrasound on my wrist to determine if it was a cyst or if I needed a more detailed MRI. The surgeon even asked my husband if he wanted to take over the ultrasound, as he was trained in diagnostic radiology as well, and he totally did. It was surreal to have my husband moving the ultrasound wand around and pointing to random blobs of static. They both concluded that it was indeed a cyst, even though it just looked like static and nothingness to me. It was interesting to see my husband defer to the surgeon for his specialty and vice versa. Story 15. I try to act like any other patient. Medical professionals can sabotage their own care by taking shortcuts or avoiding the same approach other patients use, which is a mistake. I have seen harm caused by this behavior. I don't visit the doctor for minor issues like self-limiting infections or harmless conditions, as I recognize them for what they are. However, I do see my regular doctor for problems that truly concern me or for routine exams, just like anyone else. It can be strangely stressful to be both the doctor and the patient in these interactions. I've learned not to let it affect me when I am the doctor treating other doctors. It can be detrimental to doctors as patients if they let these dynamics affect them. I try not to create stress for other doctors treating me, as that could also be harmful. Story 16. I know I'm not the intended target, but I'm an RN case manager for a primary care clinic, and going into my primary provider's office as a patient is amusing. Generally, I find that I lose all sense of medical knowledge when I or my kids are the patients, maybe out of panic. I've even called the triage advice RN for my kids, a job I do daily. If my provider asks whether I have any diagnostic requests for my own medical care, I always say, "You're the doctor. I trust your judgment," regarding how much or how little she wants to order. Story 17. I always go to someone who doesn't know me, and I wouldn't mention that I'm a doctor either. On the other hand, my SO is also a doctor, and whenever we feel something, we discuss it like a group project. However, he always refuses any treatment until his symptoms become unbearable. Story 18. I'm a doctor. As someone else mentioned, if I'm seeing a specialist in a particular field, I likely won't have anywhere near their level of expertise, so I would consult with them just like any other patient. If it's something more general and I'm seeing a GP, for example, I'll let them know I'm a doctor to avoid lengthy layman explanations. However, I still aim to maintain a normal doctor-patient relationship. I might share my opinion on what I think, but I ultimately try to stay quiet, respect their expertise, and avoid telling them how to do their job. It's also difficult to be objective when the patient is yourself or a family member. Having someone provide an unbiased opinion is often more valuable than self-diagnosing, as it can offer additional knowledge or insights you might not have. Story 19. I had a relative who was an old-fashioned veterinarian, and probably the worst patient because of it. He would argue with his doctors about his prescriptions and then order the meds through the vet pharmacy because they were significantly cheaper. Which makes sense, I guess. Why pay $50 for a particular medication when he could get the exact same thing for $5? But still, it was kind of funny seeing him in his 80s, hobbling around with heart meds that had "for dogs only" in big print on the bottle. Story 20. The pace and density of conversations are different, I'm sure. I'm an emergency physician who, over time, has treated various physicians in my community, including internists, surgeons, and radiation oncologists, some from my hospital and some not. Keep in mind that each specialty is quite different from the others. The rad once, for example, thinks and speaks differently than the orthosurgeon, and I found that my treatment of each was quite similar to treating a professor of engineering. Academically minded people tend to ask lots of questions and research things while you're out of the room, compared to populations that prefer a more paternalistic approach and just want to be told what to do so they can get on with their day. I'm careful to acknowledge that the number of hours that went into my family physician's training is the same as mine. It's simply a different topic. She knows a lot about managing and screening for chronic diseases, which I don't, whereas I know how to intubate patients, manage a bad LSD trip, or use a jar of bubbles to distinguish between kids who are scared and those with head injuries. Story 21. In 2 words, it's awful. I've experienced this as a med student during examinations where I was taught and quizzed about what I thought the problem was. Now, 2 years post-qualification, I still hate it. During training, you tend to move around a lot, resulting in little to no continuity with your own healthcare. So I've tried a few approaches. Sometimes I don't mention that I'm a doctor unless specifically asked, and I provide a very clear textbook history of what's happening to avoid misdiagnosis. Other times I've done this, but they still didn't do what I expected, leading to awkward arguments where we had to pull up the national guidelines from the internet. Now that I've settled down a bit, my doctor knows me and generally allows me to request specific tests or suggest a diagnosis if I have an idea. We then agree on the prescription or future management, which is amazing. I hope this helps satisfy your curiosity. Story 22, not a doctor, but I'm finishing my MD degree this year, YA. I just wanted to say that you don't have to be a healthcare worker or a physician for your healthcare to be seen as a group project between you and your doctor. Medicine is inherently collaborative, and if you ever have questions about why a treatment is being given or how you were diagnosed, you should always ask. If they refuse to give you reasonable answers beyond "because I said so," then you should seek a second opinion. Just because someone is leading the process doesn't mean you should be passive about your care. That's a dangerous level of trust to place in anyone. You wouldn't rely on one person to do everything in your group projects in high school, and healthcare is no different. Things always go better when everyone contributes. Story 23. Greatest doctor call of all time. First off, I'm a paramedic, not a doctor. Got a call for chest pain on the side of the road. The guy had pulled over to call 911. He wasn't local, just passing through. While my partner is applying the leads, I'm gathering some history. The guy is clearly well educated, knows his stuff, and speaks the lingo. I run a 12-lead ECG and it's not good. Not catastrophic, but definitely a "let's get the cath lab ready and drive really fast" situation. Something about it is a little off though. So I decide to try a 15-lead, then flip it again to do a right side lead. Meanwhile, we're speeding to the ER. The guy asks about nitro, so I start explaining that certain types of heart attacks can actually be made worse by nitro. He then asks to see his ECG strips. I humor him and hand them over while I'm calling in my report. He thanks me, confirms that I'm right, it's anterior, and explains that he's going to need an XYZ bypass. Turns out he's a cardiologist. Coolest, most laid-back patient ever, having a heart attack and calmly describing the surgical process he's about to undergo. Story 24, doctor here. 90% of the time, I don't even tell them I'm a doctor. They are experts in their own field, so I always respect their knowledge base and listen as if I were a regular person. Unless it's my wife who is also a doctor, then I definitely don't listen. Ever. That's what she said. Story 25. I'm a neurologist. I always assume the rarest, worst-case scenario when it comes to myself or my loved ones. I always rely on other doctors. Healthcare has become so specialized that it's impossible to know everything outside your own specialty. It's always good to ask for help. That said, I am a terrible patient. Story 26. I'm a med student. When I see a new doctor and they know I'm in med school, it's like I'm being let in on a behind-the-scenes world, and I love it. Some have spoken to me more like a peer than a patient, explaining differential diagnoses and why they make certain decisions at a more detailed level than they would for a non-medical patient. It's an impressive balance of education and patient care. I appreciate doctors who are welcoming to the next generation, showing that at their core, physicians are educators. It's humbling to be a patient, reminding me of what it feels like to be in my future patient's shoes. Story 27. Doc here. I'll share my experiences even though some folks might find issues with it. I won't sugarcoat anything. There are a few differences, most notably access. If I want to see a subspecialist, I just text or call them, and I'm in their clinic the next morning. No waiting, no referral, usually no billing, and often not even documented. If I have questions after the appointment, I typically send them a text and get a response quickly. When I see other doctors as patients, they generally get in much quicker and have more access to follow-up and direct communication than non-physician patients. During the actual visit, things are different. I generally know the format doctors prefer to hear information, so I tend to present my case that way. Things move a lot faster. Because I have some knowledge going in, the treating doctor usually asks for my opinion. Another aspect is that we sometimes don't receive the standard of care, which can be both positive and negative. For example, a couple of years ago when I had surgery, the standard approach would have been to wait and see if things improved naturally. Instead, I got an MRI that same day and was in the OR within hours. I also didn't follow the typical rehab protocol, like physical therapy, because I was already equipped to manage my own therapy based on my field. It's a strange experience, as you blend aspects of patient-doctor, professional, and often personal relationships into a single visit. The same doctor I'm seeing now might have had dinner and drinks with me just a week ago. Story 28. Before my brain tumor and Parkinson's. I had coworkers, most of whom were my friends, or known associates of coworkers. I usually have a good sense of what's wrong with me. I'm not sure if it's my knowledge or if I just know my body well. I often consult them for a second opinion, just in case. Occasionally, we would disagree on what the tests and imaging results showed. My psychologist, a professor whom I often pay to attend his lectures because I love psychology, always thinks I'm wrong about my mental state. But when another psychologist, or even he himself, tests me, I usually turn out to be right. Recently, I was diagnosed with Parkinson's, likely due to a malignant tumor in my brain. Although I didn't know it for certain, the symptoms were clear. I had poor short-term memory, hand tremors, severe insomnia, often going days without sleep before managing just a few hours, extreme fatigue, and felt like I was dragging around a corpse. I experienced intense anxiety, frequent panic attacks, and a sense of physical depression. My ankylosing spondylitis, arthritis of the spine, felt worse than ever. After undergoing an MRI, the results came in. The neurosurgeon, who was also a friend, and I grew closer leading up to the planned surgery. After the surgery, my existing symptoms improved somewhat, but new issues emerged. I started stuttering like Jimmy from South Park, struggled to read things up close, had little sensation in my legs and couldn't use them properly, often paused in my speech, and had a noticeably slow reaction time. Seeing my coworkers treat me as a patient has been a bit disheartening. Story 29. Most doctors I know, myself included, say that doctors are the worst patients, and I believe this is due to three main reasons. 1. Reluctance to visit the doctor. We are often very resistant to actually going to the doctor. We think, why should I? I already know what they're going to say and what I need to do. This mindset is flawed because we can't know everything, especially about our own health. We tend to be dismissive and inattentive when it comes to personal medical issues. More often than not, we're either too busy or scared to seek help, afraid of discovering something we don't want to hear, one of the hallmarks of a difficult patient. 2. Preconceived self-diagnosis. When we do visit the doctor, at least in my experience, we often come in with a self-diagnosis and treatment plan already in mind. This forces the other doctor to either put in the extra effort to change our minds and conduct a thorough investigation, as we would recommend to our own patients, or to simply accept our self-diagnosis to avoid confrontation, especially if it's a doctor we know from work or medical school. It's usually best to avoid seeing someone you know in such cases. 3. Delayed medical attention. This is often a consequence of the first two reasons. Many doctors only seek help when their health problems have reached an advanced stage, often due to denial. This is particularly true for mental health issues, which are common among doctors and other healthcare providers. By the time they seek help, the condition is often more challenging to treat, leaving the doctor-patient more vulnerable. So to sum up, if you're a doctor and you're reading this, please remember that you are still human and susceptible to the same illnesses you treat every day, sometimes even more so. When you became a doctor, you chose a life of helping others, So it's crucial to recognize the importance of seeking help for yourself as well. Story 30. Subspecialty surgeon reporting in. In general, most doctors have a basic understanding of general medicine and can engage in a collaborative discussion with their primary physician. When it comes to more nuanced issues involving referrals and consultations, an informed discussion can still take place. One of the most crucial aspects of being a good doctor and surgeon is recognizing what you don't know. Just as with any of my own patients, I will have a discussion, but ultimately trust the other subspecialists to practice good, evidence-based medicine in their particular field of training.